Hello, everyone. I'm Hartford Healthcare's Brian Spyros. I am outside the emergency department here at the Hospital of Central Connecticut. We're going to take you inside on a little bit of a tour to show you what the experience is like if you or a family member need to come to the emergency department for care. The reason for this is because back in March and April, hospitals across the entire country saw a decline in the number of people coming into the emergency department for care over concerns with COVID. Rightfully so, but we want to show you that here at Hartford Healthcare, we are prepared, we are safe, we are ready to treat any of your medical needs, and an emergency is still an emergency. So I'm going to take you through the process of what you would experience if you were to come here to the emergency department. We're going to come into the main entrance here, and the first thing... Hello? This is Fatma. Yes, I am here to be seen, sort of, but take me through kind of what you're going to be doing here.
All right. Any COVID symptoms today? I'm sorry,
No.
like coughing, fever, shortness of breath.
Nope, nothing.
Already 97.7, you're good.
All right,
And
so
then
I am
gonna put
cleared
the
to come
sticker.
in. Okay,
Already,
perfect.
sure.
Thank you very much. So there you go. So you would come in. Thank you, you as well. So you would come in through the door. You would be screened, you or your visitor. We'll get to more on what will happen if someone has any symptoms. But we should also mention here that employees, we go through a whole screening process ourselves, so nobody comes to work if they have a fever or any of those symptoms. So everyone is screened before coming into the hospital. Now, I wanted to introduce you to Dr. Michelle McDade. She is the Associate Chief of Emergency Medicine here at the Hospital of Central Connecticut. So just explain what the expectations are when a patient or a visitor comes through the main entrance here.
Yeah, so this is a basic level screen to make sure that anybody who is sick with COVID, potentially, is not going to be here potentially exposing others. Now, if you are sick with COVID and you are the patient, that's different. We will make sure you have a mask, we will take you right to a room, we'll minimize exposure, and we will keep you, our staff, and other patients safe. If you are not the patient, though, if you're a family member or somebody visiting and you have no reason, no other reason to be here, then we will kindly ask you to go home and quarantine yourself.
We bring up visitors. People are allowed to have a visitor, but there are some extenuating circumstances that people really should know about.
Yes. So when COVID-19 numbers were very high, we were very strict and could allow no visitors. But fortunately, the people of Connecticut have been doing an excellent job of wearing masks. Our numbers here are very low overall. And as a result of that, the numbers in the hospital are significantly lower than they ever have been since COVID started. And so you can have a visitor, but we take a humanistic approach and we want to put the patient first. So if there is an extenuating circumstance, if the patient has special needs, or if a patient has dementia and is unable to sort of talk about what's been happening or something like that, and there is a reason that you need to have an extra person or something like that, we certainly can make exceptions for that on a case-by-case basis. We always want to err on the side of safety, but we want to do what's best for the patient first and foremost.
All right, good to know. Speaking on erring on the side of safety, we have the waiting area over here. Just explain how that is set up.
Yeah, so our waiting area, we try to keep clear. During the height of the COVID-19 pandemic, we did not allow anyone to wait in the waiting room. But again, because the numbers are so much lower and the risk, therefore, is much lower, we have now allowed people to wait in the waiting room, but with appropriate social distancing. So if you look at the chairs, all of them, every other one is left open, and then every other one has a "please keep this seat free" sticker to just remind us to stay further away from each other, certainly further away from strangers and people that we haven't otherwise shared germs with.
And the good news is you said that a lot of people have been paying close attention and sort of doing it on their own without having to be told.
Yes, so we do have this room monitored by both public safety and one of our emergency techs and our admitting people. But the people of Connecticut have done an excellent job of self-monitoring. You know, although if rules were being broken, we would be here to help remind people. There's very little of that actually has been required because people have really taken on that responsibility themselves, which is really excellent and really highlights why Connecticut is doing so well and why the Hospital of Central Connecticut is doing so well in terms of safety with COVID.
All right, all good news there. So we're going to go into actually one of the rooms in the emergency department. I'll let you lead the way as we go in here. Now, it's important to notice, too, that when people do come in, obviously, you try to get them into a room as quickly as possible so that no one is having to wait in the waiting room.
Exactly. So there's two reasons for that. One is the quicker we get a patient in the room, the quicker we can get them evaluated, the quicker we can make sure that there's nothing life-threatening and all their needs have been addressed. But the second reason is so we can contain germs. If a person happens to have COVID-19, we know that if they have a mask, that protects us. We know that if they're in a room that has a door that can close or has a curtain that can close, that will further protect us. So the least amount of time that we have patients sort of out in the world, the better.
Right. So the one thing that I had mentioned in the beginning of this video is that in March and April, hospitals across the country saw a decline in the emergency departments because people were afraid to come in because of COVID.
Yes.
But that set off a whole other series of issues because people are delaying care. And if you can explain to me what you have seen people dealing with at home because they're afraid to come in, and then what happens by the time they get here. This is why we're encouraging people to come to the emergency department and telling them that an emergency is still an emergency.
Right. You really are highlighting a very excellent point. So the COVID-19 pandemic brought COVID, but also brought a host of other issues that we really didn't anticipate, having not gone through this in our lifetime. And that is, people understandably were very worried about coming to the emergency department and delayed their own emergency care. And so instead of presenting to the ER in the first stages of a stroke or the first stages of a heart attack, where we have many options and interventions to help the outcome, people were staying home. They were having their heart attacks at home, and they were coming in cardiac arrest or coming in beyond the time period where we really could do anything. And so, you know, there is the death toll from COVID-19 that I think we all are aware of, but there's a whole separate death toll that occurred from patients either having poor access to care because of it was hard to see doctors, or just fear around coming to be seen. And I really want to highlight the fact that at this point in time, August 2020, the risk of dying from an emergency other than COVID-19 is dramatically higher than the risk of getting COVID-19 and getting sick and dying from that. We can keep you safe here. Our staff has been very safe. We have antibody tested our staff. We have tested our staff whenever there is symptoms, and our entire emergency staff of over 100 people, we've had incredibly low, less than 1% of our staff get sick. And when this first started, we were afraid, like everyone was. We didn't know what the risk would be, what the exposure would be. But as it turns out, if sick people wear masks, and people taking care of them wear masks, and people coming to the ER worried about COVID wear masks, they will not get sick. So if you need to be seen, you need to come, and we will keep you safe. We are confident because time has shown that we've been able to do that.
People should not be sitting at home having chest pains or stroke symptoms and being afraid to come here to the emergency department.
Exactly. I mean, and that goes for the extreme emergencies like stroke and heart attack. But we've had people who, you know, if they would have come on day one of their abdominal pain, we could have taken out their appendix very uncomplicated. And as a result, they're coming day 3 and 4 where they're perforated and sick and requiring intravenous antibiotics and several days in the hospital and complications that were really fear-based that are not necessary. People need to prioritize their emergency and trust that we will prioritize your safety. We're good at it. We know how to do it. We have appropriate PPE for the patient and for the providers, and we will keep people safe in the ER.
All right, you mentioned PPE. I want to bring in one of your colleagues here. You can kind of come over just to show patients what they would expect to see for someone who's treating them once they are here in the ED.
Yeah, so this is Abby. She's our excellent emergency department pharmacist, and she's demonstrating what our typical PPE. So we know that COVID-19 is transmitted by droplets. So people who are sick, who are coughing or sneezing on people are going to transmit the disease. So basically what our personal protective equipment is designed for is preventing my droplets from going on to your droplets. So Abby has sort of starting from head to toe, she has a hair net, and that's just to keep any droplets off her hair. So when she goes home, she doesn't have to worry about, you know, spreading to others when she goes from room to room, and that would be changed in between patients. She has a face shield, which is specifically for droplets to just stop, to prevent them getting in her eyes. We also often will wear goggles as an adjunct, but that's really optional because the face shield will keep you safe. Abby, I don't know if you can see it, but she actually has 2 masks on.
Yeah, I see 2 of them there.
Yeah, so underneath she has an N95, and that is because Abby is involved in sort of the most dangerous emergencies where we might be sedating patients and putting a tube down their throat, and that will cause COVID germs, if they are present, to aerosolize and go in the air. So that is the highest quality mask. That will keep even aerosolized particles away from Abby. And then she has a surgical mask on top of it, and that's just to keep that N95, which is valuable, and you know we need to reuse them, so that keeps that nice and clean. In addition, Abby has a gown on, which is just to keep fluids and droplets off of her person, as well as gloves. And all of these things will be cleaned and or washed and or rotated out between patients. So we would not go into one room and wear all of this all day. We would go into one room and then we would take it off. And if we need to put it back on for another suspected COVID patient, we would put a new set on that's nice and clean. And that has worked for us. We have not had patient-to-patient transmission. We take our time, we change things out, we wash our hands frequently, we wear the appropriate gear, and that has kept people safe.
See it here. So this is what people can expect to see when they come in, just one of the safety layers that we have in place here at Hartford Healthcare. Abby, thank you very much. I appreciate it. I know you probably have to get back to work. So Dr. McDade, I also wanted to talk to you real quick about where you're seeing the numbers now. As I mentioned, all hospitals across the country saw a decline in people coming into the ED. What are you seeing here at the Hospital of Central Connecticut?
Yeah, so as fear of COVID came, our overall volume in the ER decreased dramatically by 50% or more. And that wasn't because people weren't sick. It was because they were staying at home with their emergencies, getting sicker, as we mentioned. So as the COVID numbers went up, that continued and our volumes stayed low. And now the COVID numbers, both in Connecticut and within the Hospital of Central Connecticut, have gone down dramatically. That's why the public has begun to reopen. That's why our visitor policy has become less restrictive. And as a result now, our volumes are slowly creeping up. And they are almost back to normal, which is good. People, I think, now are beginning to trust that we'll keep them safe. It's okay to come here if you need to come here. And I just can't encourage enough that, you know, we have had time and practice to know what we're doing, and we will keep people safe. So I anticipate that the numbers will go back to normal soon. Our operations within the hospital are basically back to normal. But now we are prepared. So if, you know, God forbid, another COVID surge comes, our hospital has PPE. We have the ability to surge and increase our ICUs. But if the people of Connecticut continue to wash their hands and wear masks and socially distance, I'm hoping that won't happen at all. That need won't even occur.
Finally, when you do have people coming in, patients here to the ED, I'd imagine there was a little bit of apprehension at first. Do you notice after a little bit they kind of relax once they see, well, I was screened and there's social distancing in the waiting area and, you know, the nurse or the doctor has PPE on? Did they kind of let their guard down and some of that anxiety go away?
Yeah, I think, you know, like all things in medicine, communication is the key. And so we'll get patients who now are maybe, they're probably still afraid, but still are coming. And then let's say, for example, they have a medical condition that requires them to stay overnight. And I'll get many more patients now that will say things like, oh, no, I'm not staying. I'm going home. And I, of course, sort of explore into that. Are you afraid about COVID-19? And that is most universally the answer now. And so I take a minute and talk to them and explain to them, I get it. We were all very scared. I can tell you now that the numbers are very low. You will be placed in a hospital without other COVID patients. Any patient who gets admitted, every single one gets a COVID test. So we know with certainty who is COVID positive and who is COVID negative. And the people who are COVID positive are cohorted separately away from the rest of the hospital. So, you know, it is very understandable that people are fearful. We've never dealt with a pandemic on this scale ever in our lifetime. And I think with a little bit of explanation and sort of reassurance that people do sort of settle down and realize, okay, I was afraid, but they're on it and they're going to keep me safe. And we do keep people safe.
Yes. People at home, if you don't feel good, do not delay your care. We cannot stress that enough. Dr. McDade, thank you very much. This was eye-opening. A lot of great stuff. We appreciate it. So once again, here at Hartford Healthcare, here at the Hospital of Central Connecticut, we are prepared, we are safe. An emergency is still an emergency. We cannot stress that enough. If you have any questions related to this video, please feel free to comment below. We'll answer them as best we can. For Hartford Healthcare, I'm Brian Spyros. Have a great day.